Good evening, everyone. I am Dr. Malekuma Mishra, Head of the Department of Emergency here, Yashoda Hospital, Secunderabad. So, on behalf of Yashoda Hospital and SEMI and Anbai, I welcome you all to today's academic sessions of experts appraisal on emergency medicines. So, as all of you know, our topic is deadly quartet. So, basically, that is dealing with metabolic syndrome. It's a cluster of central obesity, insulin resistance, and hypertension, as well as for dyslipidemia. So these four quadrants are there that will altogether pose a major global health challenge. So to understanding this syndrome is a vital for early recognitions as well as for timely management. That is particularly we deal in emergency room settings and as well as for acute care practices. So we are honored here to have with us our speaker, Dr. Susmit Mishra. He is a consultant and head of the department emergency medicine at some hospital, some Ultimate Medicare, Bhubaneswar. He is the current president of SEMI Odisha chapter. So, like with that, let us begin. Now I invite our speaker, Dr. Susmit Mishra, to take up the through today's sessions and give us some fruitful outcome. Thank you. Over to you, Dr. Susmit.
Thank you so much, Malay. And it's an honor to speak on behalf of our state, as well as thank you, Yashoda Hospitals, for the opportunity. So basically, our topic for the day is the deadly quartet, which is metabolic syndrome. And to start with, so basically, what is metabolic syndrome? What does it mean? How it can be recognized? And basically, if I say actually it is a syndrome which is under-recognized, we do not recognize it as often as we do other diseases in our emergencies or maybe even in the OPDs. So it refers to the cluster of risk factors known as metabolic syndrome. It is not overall a syndrome, but it is a cluster. It includes obesity, especially central obesity or the abdominal one, high blood pressure, high blood sugars, or insulin resistance. Earlier, this syndrome was called as X syndrome or insulin resistance syndrome. Now its name has been changed to metabolic syndrome. And along with that, unhealthy cholesterol levels. I feel when I see these clusters, I feel probably most of us would have had that, but we never recognized it. And this combination significantly increases the risk of serious health issues like cardiovascular diseases, stroke, and diabetes, of course. The contribution of obesity, as we all know, to cardiovascular risk has not been adequately appreciated because of a failure to recognize the involvement of upper body predominance. So we say something as central obesity.
Actually, your slide is not visible.
My slide is not visible?
No.
Oh. Is it visible now?
Sir, we can see it.
You can see it? Malay?
I think I am not able to see. The background people from the live sessions is going on. It is not visible to me.
Oh. Should I do that again? Should I stop and should I do that again?
Just do the sharing once.
Yeah, it is being shared now. I'm stopping it and doing it again.
Okay, okay.
Is it visible now?
Yes, yes.
Okay.
Now it's visible. Just make it large.
Yeah.
Yes.
It's done? Okay.
Yes, yes. It's perfectly fine.
So coming back to the topic again, we need to appreciate the central obesity actually to cardiovascular risk has not been adequately appreciated because of the failure to recognize the involvement of the upper body with hypertension, diabetes, and of course hypertriglyceridemia, even in the absence of a significant overall obesity. So there are sometimes we see patients who are very lean and thin also, even they can have a raised triglyceride levels. So it's a misconception that only people who are obese have a high level of cholesterol. So even thin people can have. But some people you can see that they'll be thin, but they'll be having a big belly. So those are more dangerous than the people who are actually fat. So central obesity is a major cause of most of the sequelae like strokes or MI. So that should be taken into consideration. This presentation that we are doing today demonstrates the evidence that upper body obesity is usually induced by caloric excess in the presence of androgens mediates these problems by way of hyperinsulinemia. Because of these interrelationships, there is a need to identify and prevent upper body obesity, or failing that, to provide therapies that will control the associated problems without aggravating hyperinsulinemia. The syndrome is closely related to a generalized metabolic disorder called insulin resistance, in which the body cannot use insulin effectively. Metabolic syndrome has been called by many names that I have already said, like syndrome X, the deadly quartet, insulin resistance syndrome. So all these were the previous names, and now we basically make it a cluster and say it as metabolic syndrome. So as you can see, these are the deadly petals in this flower. So one is obviously, as we have talked about, hypertension, high triglyceride levels, visceral obesity, insulin resistance, and low HDL cholesterols. Coming on to the pathophysiology of the metabolic syndrome, as you can see here, in type 2 diabetes mellitus, due to insulin resistance, there is hyperglycemia. Due to endothelial dysfunction, there is arterial hypertension, and with that there is always a systemic low-grade inflammation. So due to the visceral adiposity, obesity is there, increased BMI is there, and then there can be atherosclerosis leading to dyslipidemia, and obviously we find what is increased triglycerides, increased LHDL, which are bad cholesterols as we name them. Okay. So this is an overview of metabolic syndrome associated osteoarthritis. Though this is a sequelae, but I found this diagram to be very interesting, and I think they have given the pathology very nicely. So basically, we see all the components that are there. One is diabetes, one is hypertension, dyslipidemia, and they are showing that when there is adipocyte hypertrophy and inflammation, there is a release of adipokines, pro-inflammatory cytokines, and free fatty acids. So this in turn leads to macrophage infiltration, synovial inflammation, and cartilage damage. So we get as osteoarthritis. In diabetes, obviously there is synovial insulin resistance, there is high glucose level. Again, the mediators are released, so they can also lead to osteoarthritis. In dyslipidemia, there will be hypercholesterolemia, increased cholesterol accumulation in the chondrocytes. In the chondrocytes, there will be mitochondrial dysfunction, and again, it goes back to the same thing, that there will be osteoarthritis. And in hypertension, we all know there will be subchondral ischemia, compromised nutrition and oxygen, and there will be apoptosis of the osteocytes. So these all things lead to basically a sequelae of metabolic syndrome, which is osteoarthritis. Now, how do we categorize, or what are the criteria for the metabolic syndrome? So these are for the Indians basically what they have, because it differs from race to race, it differs from one region to other. For Americans it is different, for Indians it is different. So what are the risk factors? The risk factors are abdominal obesity. So there is the waist should be more than 90 to be categorized as metabolic syndrome in men. It should be more than 80 to categorize in women. The triglyceride level should be more than 150. The HDL should be, in men, it should be less than 40, and in women, it should be less than 50. Blood pressure cutoff has been given as 130/85, and the fasting glucose has been given as 100. So, when it is diagnosed, when metabolic syndrome is diagnosed, when a person has 3 or more of the following conditions. One is a large waist circumference, which is over 40 inches for men, I have already told, 35 for women. It's a high triglyceride level, basically more than 150. Low HDL, less than 40 for men and less than 50 for women. And high blood pressure cutoff is 130/85. And fasting blood sugar should be more than 100. So we use the mnemonic waist in case of metabolic syndrome to categorize or to make the criteria. So the mnemonic is W is obviously for waist circumference, like we have already talked about. So people with metabolic syndrome typically have an increased waist circumference due to excess abdominal fat. So abdominal obesity is obviously that we have given the criteria as more than 35 in women and more than 40 inches in men. A is for atherogenic dyslipidemia. This refers to an abnormal lipid profile characterized by high triglycerides, low HDL. HDL is the good cholesterol, so that is low, and borderline high risk LDL cholesterol. Fasting serum triglycerides has to be more than 150 to categorize it as metabolic syndrome. And obviously, the borderline high risk LDL cholesterol should be ranging from 130 to 159. In waist, I stands for insulin resistance. This is a condition in which the body's cells become resistant to the effect of insulin, leading to high blood sugar levels. And S, sugars, fasting should be more than 100. And T stands for tension in the vessels or hypertension. So the blood pressure should be more than 130 by 85 or on antihypertensive medication. So you can see the picture over on the right. All these have been mentioned properly. So this should be the condition of the patient who has a metabolic syndrome in general. So what are the risk factors or the causes of metabolic syndrome? Everything can be seen here. First is you have a cardiovascular disease, you are obese, you are adding up calories by having junk food like burgers, juices, and all fried foods. Then you can have increased activity sitting at home, like sedentary habits. Okay. Then you can obviously smoking is a big factor in atherosclerosis as well and in metabolic syndrome as well. Decreased sleep, that I think most of the doctors have. We sleep late, get up early, and then finally we might end up in metabolic syndrome. Stress, I think we should not ask, that all of us know very well what is stress and we have been going through. And then diabetes, obviously. It's a genetic. So if you are in the family where your grandfather, your father, everybody has, so you get it. What are the causes of metabolic syndrome? First is obviously genetic mutations, which can lead. Some people are constitutionally thin, some people are constitutionally obese. They're obese since birth. You don't have an explanation for that because even when they are born big, and then obviously they go on to become big, become fat and obese. There can be some inflammations which can cause metabolic syndrome as well. We have already talked about insulin resistance. So when there is lesser utilization of insulin in the body, and obviously sugars are high, then obesity and lack of physical activity, and obviously hypertension, which can lead to metabolic syndrome. Coming on to the prevalence of metabolic syndrome in Indians, obviously this also differs when you go to different countries or different continents. So in India, the pooled prevalence is around 26% for males and 35% for females, with higher rates observed in females and increasing with age. The prevalence also varies by diagnostic criteria, and while more common in adults, metabolic syndrome is increasingly seen in children and adolescents. And I feel that all of us know the reason. Now people don't go out to play. They are with their mobile all the time, sitting at home, no physical activity. So obviously it is increasing in children and adolescents also. For adults over the age of 40, more than 40% are affected because obviously your activity goes down beyond 40. You're not that active as you were in your 30s or 40s. As it increases more than 40, your activities goes down. Maybe you're not working out. So all those are there. Metabolic syndrome prevalence has increased by 61% over the past decade, and rates differ among races and genders. This is also quite well understood why it has increased over the past decade, because people have been stressful, people are getting more stress, food habits are not good, sleep habits are not good. So all those have affected, and then we come to the increase in metabolic syndrome. When is it time to seek medical advice? That is very important because people normally ignore, okay, I got diabetes, that's fine. I am obese, okay, I'll work out someday. I join a gym, I leave after 4 days. I don't feel like making food at home today, so I'll go out and have food. All those things actually contributes in the end to metabolic syndrome. So you should know when it is time exactly to seek medical advice. So the presence of one feature of metabolic syndrome, such as high blood pressure, high cholesterol, or an apple-shaped body. Remember, this is very important in metabolic syndrome. Normally, the people with metabolic syndrome have an apple-shaped body. That means there will be central obesity. There will be belly fat will be more than other parts of the body. The abdomen will be big, and all those things are there. An individual may already have the condition and not know it. First of all, the individual doesn't know about the condition. Next is we don't diagnose it thinking, okay, one thing can be taken care of, the other thing can be taken care of, and finally we end up in all these things together. So it is important to talk to your doctor or with your doctor about testing for other components of the syndrome and develop a plan to avoid serious disease. So prevention is better than cure. Once you get it, you have to cure. But if you can prevent it, it is always better. Now coming on to the prevention and the treatment of metabolic syndrome. I know maybe these are all very normal things that we say we can commit to a healthy diet. But most of us are not able to do that. So eventually we'll go into metabolic syndrome. So if you really want to avoid it, this is the time that you should shift to a healthy diet, which should include plenty of fruits and vegetables, choosing lean cuts of white meat and fish over red meat. Obviously, red meat should be avoided. It should not be that often that you eat. Avoiding processed or deep fried dinners, like we get it from the frozen shops, we keep eating it for a longer time. That is also going to a bad healthy atmosphere environment. And eliminating table salt by experimenting with other herbs and spices. So salt is we have been knowing since age old, I think, that hypertension, if you have hypertension, you should have less salt. You should not, maybe no salt is also okay, but according to the taste you can add, but it should be less. So that is obviously a healthy diet, not taking salt. Get moving. So basically, just a minute, excuse me. Okay. So it is important to stay active. I think in my family also, I see my friends also who are basically into softwares and all. The whole day they'll be sitting with the computer without any workout at all. So it's a sedentary lifestyle, and that has a major role to play in this metabolic syndrome because they are obese. They get all this in diabetes, blood pressure, and all because they have no workout at all. So at least 30 minutes of moderately strenuous activity on most days of the week is recommended. You may not do all 7 days, but at least 3 to 4 days in a week is a must. Schedule regular checkups. I tell my patients that after 40, you have to have a checkup at least every 6 months, and after 50, it might be 3 months also. But before that, if you are checking like maybe from 30s to 40s, at least once a year it should be done. Everybody should know what is the condition of the health. Only then they can improve or they can consult a doctor. So what are included in the regular checkups? Assessing blood pressure, cholesterol and blood sugar levels annually. Early detection of these problems can help with formulating lifestyle modifications. If I consider something 20 years back and now, I think more people in the young age have now hypertension, diabetes, all these things. So regular checkups can at least diagnose that, and you can start medications and even lifestyle modifications. Okay, coming on to the treatment proper. So the definitive treatment, if you say, the underlying insulin resistant state is the primary target of therapy. The primary goal of treatment is to prevent type 2 diabetes, heart attack, and stroke. To reduce insulin resistance in overweight and obese individuals, the preferred method is an aggressive regimen of self-care strategies focusing on diet and exercise. All diabetic patients that we see in our regular routine life is we say that if you have hyperlipidemia, then your diabetes will not be controlled. The reason being, I think we all have studied about biochemistry in our college days. that this extra fat that is deposited, they release sugars into the blood. So when we are, even if the insulin is released from the pancreas, they're not able to neutralize that. So when you have obviously more of a fat, then your insulin will not be able to saturate your sugars, and obviously sugar will be high, and that is what we call it as insulin resistance syndrome. It is common to routinely monitor the following to ensure that life modifications are working. One is obviously weight. It is not only the metabolic syndrome, but for any disease, first recommendation is always weight. So you have to reduce your weight. Blood glucose has to be maintained. Many people who have blood sugars are afraid to take medications, are afraid to take insulins. So they do not do that. And finally, they end up having a sugar of more than 500, 600 and all those things. And they can cause a lot of damage. Cholesterol, obviously, the bad cholesterol and good cholesterol are there. The good cholesterol ones are HDL and all, and bad cholesterols are all of the others like triglycerides, LHDL, LDL, and all those things. So those have to be put in proper range, have to be taken care of. Okay, and then comes blood pressure. There are people still who believe that if I have blood pressure, I'll start medications, and in a few days it will be done. I'll not take any medications. But that is the biggest blunder that you might do in your life and end up having a stroke and landing in the hospital. Okay? Losing as little as 5 to 10% of your body weight can reduce insulin levels and high blood pressure, thus reducing your risk of diabetes. So when you are having sugars, if you are reducing your weight, that is what is called as lifestyle modification. Some people with pre-diabetes, I can say, maybe their sugars have not gone beyond a limit. Maybe their HbA1c levels are 6.5. So if you start working out, then maybe you might not need medications for some more years. So if you are doing that, obviously your sugars will be less and you may not have to take medications as well. Walking just 30 minutes of a day or engaging in other aerobic activities can help prevent the serious diseases associated with multi-systems, basically. So when you're working out, you are going into the fresh air. People say, sir, the whole day I keep walking in the house, but that is not sufficient. You need fresh air, you need oxygen. So for that, you have to go out, maybe in the morning or the evening, whatever time is suited for you. And that will help you in reducing these complications, basically. Smoking cigarettes increases insulin resistance and worsens health consequences associated with metabolic syndrome. We, all of us, I think, since our college days have been talking about smoking alcohol. The smoking has to be stopped. There is no other way out. If you really want to stay healthy, you have to stop smoking. Smoking not only affects your lungs, but it affects your arteries and veins also. Whole grains, beans, fruits, and vegetables are high in dietary fiber. So these are important foods to eat since dietary fiber is known to lower insulin levels as well. Now coming on to the pharmacological therapy, there are some weight loss drugs. So along with diet and exercise, it may be necessary to prescribe weight loss drugs because there are people who say, I drink water and I gain weight. Though that doesn't happen, but constitutionally they are obese. For those people, I think sometimes we need some drugs like sibutramine and orlistat. So these basically lower down your fat and obviously lower down your weight as well. Then, since we have talked about metabolic syndrome was earlier known as insulin resistance syndrome. So insulin sensitizers are required for the therapy of metabolic syndrome. So in individuals with diabetes, doctors often prescribe thiazolidinediones and metformin to decrease because these are called as insulin sensitizers. They sensitize your body to insulin. So you're actually, after taking these drugs, the levels of insulin that you're taking might come down. So these medications may also be useful in improving insulin metabolism in individuals with metabolic syndrome. Aspirin is a drug we all know we use in MI. So these are often prescribed to help reduce the risk for a heart attack because These are called as blood thinners. So they allow more of the blood to go into your arteries. The flow is better. So obviously, till the time you have not come up to a limit, maybe aspirin may be required for you. Then there are other medications that are used for lowering blood pressure that we know, maybe diuretics, maybe AC inhibitors, maybe calcium channel blockers, and beta blockers. These are specific therapies that we are giving to each of the component of metabolic syndrome. And obviously, to regulate cholesterol, we have statins, we have fibrates that can improve cholesterol in the following ways. They reduce the level of low density lipoprotein cholesterol, which is called as bad cholesterol. They increase the level of high density cholesterol or good cholesterol, and they decrease the level of triglycerides, which is another bad component, because basically when we talk about triglycerides, these are the cholesterols that get deposited in your smaller arteries like your coronary arteries or maybe your arteries in the brain. So with that, I think I sum up the concept of metabolic syndrome. As you can see in the picture, there's a evolution from fat to fit, and this is which is required for the metabolic syndrome. If you really want to be away from this, you have to follow this. I think that's all. Thank you, Dr. Malay.
Thank you, Dr. Susmit, for a wonderful sessions. And is there any questions from the audience side? So, like I have few questions for you, Dr. Susmit. So,
Yeah, sure.
why is central obesity considered the hallmark of metabolic syndrome?
See, there are, what I believe is, in case of central obesities, the cholesterol is deposited only in a localized place. It is not like decentralized to other places in the body. So when it is centralized, the risks of or the sequelae are more and more. They get basically deposited in the the organs, basically the organs around the organs. So that's why they say that if a person is fat, may not be that his cholesterol levels are high. A lean individual even can have that. So you should always avoid having central obesity. Overall obesity is also bad. I will not say that it is good, but it basically affects our organs. So I think central obesity is the main component in metabolic syndrome.
Yeah, because basically it deposits in the visceral fat areas that
Yeah.
release fatty acids and cytokines release. That's the inflammatory
Absolutely.
markers. And ultimately that will driven the insulin resistance.
Mm.
So ultimately the person will be centrally obese and will be having insulin resistance.
So,
So how does this insulin resistance contribute to the hypertension?
okay. So insulin resistance is basically because of what we say is that insulin is being produced by the pancreas but not being utilized by the body. So basically they have an effect on the blood vessels. What is blood pressure? Blood pressure is basically the pressure exerted by the blood on the lateral walls.
Yes.
So once we have high sugars, insulin hyperglycemia is there. So insulin is not being used by the body. So obviously they have finally the effect is on the blood vessels, which causes hypertension, is what I believe. If you can add, I would be happy.
Yeah, like two things. Like one is because of insulin resistance, there will be hyperinsulinemia, and that will directly leads to increase in sodium, like reabsorption in the body. So ultimately, the sympathetic drive will be more, and there will be like endothelial damage, dysfunctions. So that will ultimately leads to increase in blood pressures. So because of
Blood pressure,
sodium reabsorptions, BP shoots up.
reabsorption,
Yeah, reabsorption is there. And
Good.
like one last question is basically what are we have explained very well management, particularly the medicine part is concerned. So the first line therapy is,
Yeah,
as you mentioned, lifestyle modifications and diet and exercise.
absolutely.
That we know we are unable
Mhm.
to do it, but we should do it. And like preferred antihypertensives for metabolic syndrome, like which category of drugs should be focused more? You have explained like it should be angiotensin converting enzymes inhibitors, AC inhibitors or ARBs. That
Yeah.
should be the first line. If someone develops some kind of adverse reactions, we can switch to beta blockers.
Yeah. Even calcium channel blockers
Calcium
can be
blockers
advised.
also can be given.
Yeah.
So any more questions from the audience? If there will be no questions, then we'll wind up these sessions. So thank you everyone for joining us today. A special thanks to our speaker, Dr. Susmit, for an
Thank you.
excellent sessions, and to our chairpersons and organizing team for the support. We appreciate the active participation from the attendees, and as part of our Friday academic sessions are concerned, we'll continue to bring more relevant topics for emergency medicine specialties. So with that, we conclude today's session. Thank you everyone. Have a wonderful evening. Thank you.
Thank you, Malay. And thank
Thank
you,
you so
the
much.
organizing team. Thank you, Chairman, for the opportunity.